Okay guys, the topic that we will be dealing now will be the scapular spaces. So first and foremost, it is a intermuscular space. And now moving on to the intermuscular spaces diagram. You'll have to draw the scapula along with its spine. And then the humerus along with the head of humerus and the shaft of humerus. And then you should draw the long head of triceps, the teres minor and the teres major. And now we move on to the upper triangular space. There are two things to write about the upper triangular space, that is the boundaries and then the contents. So for the boundaries, the superior, inferior and lateral boundaries. The superior will be teres minor, inferior will be teres major, and the lateral is going to be the long head of triceps. And now on to the contents. It will be the circumflex scapular artery. And now the quadrangular space. It has four boundaries: the superior, inferior, medial and the lateral. Superior will be teres minor, inferior will be teres major, medial will be long head of triceps, and the lateral one will be the surgical neck of humerus. And then the contents are the axillary nerve and then the posterior circumflex humeral artery. And then we move on to the lower triangular spaces. Has three boundaries that are the teres major superiorly, medially the long head of triceps, and then laterally the shaft of humerus. And then there are two contents: the radial nerve and the profunda brachii artery. And now the topic that we will be going on will be with axilla. Axilla has boundaries: the apex, the base, has four walls, the anterior, posterior, medial and lateral walls. So now we move on to the apex. It is directed upwards and it is also known as the cervico-axillary canal. Now moving on to the base. It is directed downwards and it is formed by the skin, superficial fascia and the deep fascia. Anterior wall is formed by the pectoral region muscles. The pectoralis minor, major and subclavius. And now to the posterior wall. The muscles related to scapula. Those are the teres major, subscapularis and the latissimus dorsi. And now the medial wall. It is formed by the upper 4 to 5 ribs and serratus anterior. And then the lateral wall, which is formed by the upper end of humerus, bone, biceps brachii and coracobrachialis. And then on to the contents: the axillary artery and its branches, the axillary vein and its tributaries, and three cords and branches of brachial plexus. These three things are surrounded by the axillary sheath from the prevertebral fascia. Then we move on to the applied anatomy. That is the axillary abscess. Whenever there is an abscess, we should also learn how to drain the abscess, which will also be the applied anatomy. In this part, it is making an incision in the base of the axilla, which will drain the abscess. That's easy anatomy for you. And if you like the video, please like and subscribe.